It is Friday, April 10th. Good Friday and good afternoon to all of you. And this is the COVID-19 Task Force Daily Update. We have 3 people to speak to you today, and we'll get right down to it. Starting off with Dr. Annick Gauthier of the Kahnawake Memorial Hospital Center. Let's welcome her.
Miawa. So today I'm not really going to do question and answers. I have one question and answer in the middle of it, but today everyone knows my hatred of people wearing gloves who are not doing surgery or procedures. But today I'm going to take off my kid gloves because you've sort of seen on me being here nice and friendly and laughing. Today it's not that. Today I want to show you my frustration, I'm despaired by what's going on. The number of cases in Kahnawake, the number of cases in Quebec, the number of cases in Canada do not matter. And the reason why they don't matter is because it would only matter if we were testing every single member of the population of Kahnawake every week to know your COVID status. We're not going to do that. What does matter is the number of deaths and preventing deaths, because that we know exactly what number that is. I'm so angry that I forgot to wash my hands. Having 12 cases in Kahnawake is not a sign that we need to have the party this weekend and have a celebration and have everyone get together. If you want to celebrate, you celebrate within your family unit and you go on FaceTime or Skype or Zoom or any other means that you have, but not together. You can be together in spirit, but not in physical presence. The one question and answer that I'm going to add, because I think it's very pertinent to this, is someone asked me while I was giving the radio interview yesterday morning, what about the comorbidities of our population in Kahnawake and how does that affect COVID status and what could happen with COVID? And I think that is incredibly important. So thank you for that person for asking the question. We have higher rates of diabetes than the rest of Quebec. Our population gets diabetes earlier, on average about 10 years, than the rest of Quebec. We know that having diabetes, having blood pressure, and the same thing can be said about a variety of chronic diseases, we get them earlier and we have them more. They put us at greater risk for complications of COVID. And you know what? I am so pleased that we have 0 deaths and 0 hospitalizations due to COVID in Kahnawake, but I want to keep it that way. My patients and my coworkers, but specifically my patients, have been, every time I've been calling, because I've been doing phone calls, phone appointments, teleconsults, all the last 4 weeks, they have been thanking me for all the work that I'm doing in Kahnawake. And this is where I'm going to be really honest with you, how many hours I put into this. So I work minimum of 14 hours a day, up to 20 hours a day. Yes, there were days I slept 4 hours. Not because I was anxious, because there was that much work to do. And that work is to keep you safe. We're all working here to keep you safe. I'm paid to see patients. I'm not paid to do this. I'm not paid to do all of this organization administrative work. But the reason I'm doing this is because I care about the community. I mentioned at a staff meeting a few days ago that I feel like I'm a member of the community, and I don't know if you feel that I'm a member of your community, but I feel like I'm a member of your community and I want to protect it. So I ask you all, I implore you, that if you can do one favor for me, it's staying home, it's washing your hands, it's social distancing. Thank you.
Well, now, Dr. Gauthier, very well put, getting right to the point. And we really do need to pay attention and stay the course. All right, coming up next is our daily visit from Lisa Westaway, the Executive Director at the Kahnawake Memorial Hospital Center.
Good afternoon. For those who know me, I think this is the first time in my life I can say I don't have anything to say. So I actually will despite the fact that we will celebrate in our homes with our immediate family, I do wish you a wonderful weekend. I wish you love, support, caring for each other, lots of positivity, health, happiness. I wish that for all of us, and some rest for all of us as well this weekend. And we'll see you tomorrow. Okay, thanks.
All right, short and sweet. Earlier today, my wife went to the market, pick up a few things that we needed. I'm happy to say that the people from Kahnawake actually were lined up 6 to 8 feet apart. But I also saw a couple of things that were kind of made me realize that the message isn't always getting through to, and not Kahnawake, but elsewhere. Because while I was outside waiting for her, there were the peacekeepers pulling over some guy looking for cigarettes. And to the great credit of the officer, she was very polite, but made it very clear. She said, "How can you say that? There's signs all over the place. We have the electronic billboards going on. There have been messages out there, and some people just don't want to hear it." And there was also a gentleman who was trying to get into the market, and the people from town were saying, "Wait, you're not from here." And he was speaking in French, and he was trying to pretend he didn't know what was going on. But luckily, I have a little bit of French, and I was able to explain things to him. But he still didn't want to hear it. He said, "I'm so hungry, I need a..." He didn't look hungry. But the fact is, the messages aren't getting out for some people, so we have to be patient. But the peacekeepers have been doing their job, I'll say that. That's the second time now I've seen them having someone pulled over. Keep up the good work, because we're trying to just keep ourselves isolated and do what's right for not only our community, but out there as well. So, you know, with that, I'd like to hand things over to our Commissioner of Public Safety, Lloyd Phillips.
Thank you once again, Joe. Thank you, Dr. Gauthier, for, I guess, being very clear and very frank in your comments. What I want to focus on this afternoon is a couple of points. One, again, is something I touched on a little bit on Wednesday, but now I have a graphic I want to show you. And this graphic comes off of a website that's Quebec.ca. I know we talked about it several times. And normally, you know, in my everyday life, I don't refer to Quebec.ca very often. But in this case, they're doing an excellent job on putting information together. So if you take a look at the graph that's on the screen, it looks at, you know, the possible number of deaths. And as Dr. Gauthier talked about, that's what we are ultimately concerned about. You know, people may get infected with the virus, you know, and many of them and most of them will do well and recover. But unfortunately, there are that segment of the population that will not do so well, and there will be a segment of the population who will not survive the virus. So this graph that's on here, you can see it's based on some of the information that was gathered throughout many European countries, primarily Italy, Portugal, and Germany, where, as we heard many times, Italy had done, they haven't taken measures very seriously, and they were very slow in response. So their death rate was very high, and they're still losing people by the hundreds on a daily basis. Whereas other countries such as Portugal and Germany were very proactive. They got involved. They instituted many of the measures that we have similar here in Kahnawake and around Quebec in terms of the social distancing, having people stay home, essential services only, hand washing, and all these other things that we've been talking about. And you can see the purple area on there represents, you know, a scenario based on proper measures being taken and proper measures being followed. And you see on there it has a number of around 1,200. And if you look where the blue area is on top, you know, it goes all the way up to nearly 9,000. So obviously there's a very wide gap between, you know, 1,200 to 9,000. But that's the area that's, you know, basically a gray zone. And if you look on there's a yellow area, which is the current projections within the province of Quebec. You can see it's slightly higher than it is with the purple. But generally, no, we are on track to be at the very lower end of that scale. But we're only going to get to that lower end of the scale if we keep up the measures in which we are doing and really take them seriously, because we said it time and time again about this next week, this next 2 weeks are going to be very, very crucial, because the peak is estimated to be in the province of Quebec around the 18th of April. So at that point in time, we should reach that peak, and we know at that point it'll level off. It'll stay at that peak for some time before it starts to drop. And if we let off the measures too soon, that peak may just keep on rising, and we might see those numbers entering into the 2,000, 3,000 people who will perish from this virus. And those numbers are numbers of people who are projecting, and the best case scenario at this point, is 1,200 deaths by the end of the month. That's a lot of people. Considering at this point in time, the rate in Quebec is around 220 or thereabouts. So that's a significant increase over the next few weeks. And we want to keep that number as low as we possibly can. And especially for Kahnawake, I want to see that number at 0. And we can only do that with the support of the community and really pushing hard to ensure what we do from here on in over the next few weeks is even buckle down even harder. I know it's frustrating. I know a lot of people have been mentioning things on Facebook or talking to people on the street and saying, when's this going to end, and so on. This is the time that we're at crunch time now. We're approaching the peak of how this pandemic is going to impact our community. So now we really got to buckle down, ensure that we take those measures, if you want to say extra serious at this point in time, to really see us through this period. Once we're on the other side of that, obviously everything is always being reassessed. We'll see where we are in 2 weeks. We'll see where we are in 3 weeks. Hopefully, we'll be looking back at a positive time. So again, without your support, that certainly will not happen. Because over the past week or so, there was kind of that a certain sense in the air of saying, well, maybe it's not going to be as bad as we thought. So people were getting a sense, well, maybe we could get together in small groups, or we could not really worry about things too much. But I just wanted to be here to emphasize the fact, looking at those projections on where the best case scenario is going to be. Obviously, the higher those numbers, the higher the likelihood or chances of that's going to impact directly in Kahnawake. And again, that's the last thing that we all want to see. We don't want to have people get a false sense of security, thinking like, well, it ain't going to be that bad, so I'm not going to abide by what's going on, or the numbers that were released yesterday, and saying, well, it's only 12 people. We don't want people to think, well, it's only 12 people, so why are we doing this? Maybe it's only 12 people because we are doing this. And that's, I think, the take-home message from that. What I also want to just talk about really briefly, is the whole task force. Not just myself. We all have our circles that we talk to individuals and our family, our friends, on social media or in our household, and we all hear different things and what's happening. So we take that all in as well, and that helps guide what we do here. Obviously, Facebook is a big thing, and it's a great tool for us as we're standing here right now. We're on Facebook Live to get information out to the community. It's a very valuable tool. But on the flip side, obviously everybody likes to chime in and make their comments on Facebook. The task force, observes what's happening, but we don't make our decisions based on Facebook. Because if we listen to what on Facebook, one day we'd be going left, the next minute we'd be going right, maybe even going backwards. When what we need to do as a community is continue moving forward. Assess what we're doing, keep moving forward, push through this next few weeks, and then reassess where we are. So that's the key point that we have to really be sure our community really understands. And sure, people can have their comments and they're welcomed, But just keep in mind in the context in which we are currently living in. Nobody lived through this. You know, you listen to the media, you know, CNN and the world media and CBC, CTV, whatever one you watch. There is no playbook for this. This is new for everybody. The world is adjusting as we're witnessing it. We're living history as we speak. So you know, the new normal is going to be the new normal for the next while. So I think that's important for people to really, you know, really, I guess, maybe digest that and really take that home with you. Maybe as a final point, what I just want to talk about is a couple of maybe some of the summary of the week, kind of the things that we did over the past week or so. First of all, this week was the first time, I'm glad to say, we had representation from the 207 Longhouse as well as Moe Trail Longhouse participated in the task force meetings. So we certainly welcome their participation, and I'm sure they're going to bring some valuable insight to what we are doing. Some of the new other developments this week, the Kahnawake Fire Brigade paramedics now have to wear full protective gear for all calls. So regardless of what the call is, they have to wear a full gown, face shield, mask, and goggles. So if you see an ambulance respond to a call and they're fully donned in their gear, don't necessarily be alarmed, because that's the standard protocol that they're going to have to be following for the foreseeable future, because there is that community spread of the virus. So somebody could be calling, you know, for a broken ankle. They are going to have to wear the full gear regardless. So just so you're aware of that as a reminder. We did receive additional personal protective equipment this week. So we're in good supply in the community for the next little while, as well as Kahnawake Memorial Hospital Center had loaned a bunch of gowns over to KFB this week. So that's another sense of good, you know, community sharing, to make sure that everybody has what they need to do the job properly, and obviously to protect our first responders. You know, as you've seen this week, signs went up all over the community informing the outside that Kahnawake is for residents only and essential services. You know, the peacekeepers have put on extra patrols to ensure that, you know, those signs are followed and obeyed. And as Joe Delaron just mentioned, you know, anybody who's not from the community is subject to be pulled over. And if they have no purpose for being here, they will be escorted off the territory. And if also, depending on the situation, they may be subject to fines. So that's another development this week. Also, the emergency food service is up and running. That's been going on for a while now, but it's still something that has to operate every day. So that's up and running. The emergency isolation shelter is also available for those who may require it. So no, there are all these things that are also in the maintenance mode. So it's been a very busy week. You know, we've been taking a lot of phone calls and doing a lot of clarifications, or a lot of reassessment of how things are happening in the community. It is a long weekend for most, which is fine, and I hope people find a way to celebrate amongst their family for the holidays. No, but rest assured, no, the task force is available 24/7. Public safety unit, we have somebody on call 24 hours a day. We work today, we're working Monday, so anything the community needs, it will be available. We have our inspectors that are also out there who are going to continue doing their due diligence in and around the community. So, you know, as long as this pandemic is impacting our community, you know, the task force will remain intact. We will do what we have to do to maximize the safety and security of our community. So with that, I'd like to wish everybody a happy Easter. Enjoy your time off if you have some time off, and I want to get away.
All right, thank you very much, Lloyd. And with that, I can tell you that it's been not a pleasant couple of days weather-wise, but as we are, for those of you watching this live, the sun has come out, and hopefully the rest of the weekend will be like that, and that'll help bring a little extra joy into our lives, because we need every little bit of help. I just wanted to finish up with one thought, because I ran into one of my friends while I was waiting outside for my wife to do the shopping. And he was having a hard time because he's a single guy and he's following all of the directives. So he says, you can only stay inside so much and you can only watch TV so much. So remember, try and be creative, come up with some things. If you're on social media, get talk to your friends, pick up the phone, talk to your friends, and just, if you can, go out for a walk, because now it's nice out there, but just make sure you give plenty of space, because that's really what this is all about. And as Lloyd said yesterday, if you don't move, the virus doesn't move. Stay in one place as much as possible, stay in as much as you can, but be safe, and we'll be back tomorrow with our COVID-19 daily update. For now, have a good Friday, and we'll see you tomorrow. Take care. Nyao ko, dano, onigi wahi.